This is Dr. Mark here, and today I want to talk to you about cardiovascular disease. And I've been passionate about this because it is the #1 killer of Americans and the #1 killer of both men and women in this country. And I feel we have a mentality in my profession, the medical profession, that we will wait until you have a heart attack or stroke and then we're going to intervene. And this is wrong, and it is not the right way to go about this. There is the knowledge and the technology out there so that you can prevent an event. I always say, if you're having a heart attack or stroke, you need to go to the heart hospital. But that diagnosis is not that difficult. But if you are not having a heart attack or stroke and you feel well and you say, I have no history of heart disease in my family, making that diagnosis requires a little bit more investigation, determination, but it can be done and you can actually prevent an event. Did you know that 80 to 90% of heart attacks are preventable and 50% of strokes? This is a massive amount of suffering that is going on that is totally preventable. Now, I'm going to use an example of Mr. Tim Russert to explain what I want to tell you. Mr. Russert was the NBC News moderator for Meet the Press. He was 58 years old when he died. 2 weeks prior to his death, he visited his cardiologist and was told he had a 5% chance of having a heart attack in the next 10 years. He was 58 years old. A 5% chance of having a heart attack in the next 10 years, that's an extremely, extremely low risk. Yet at autopsy, he was found to have soft plaque. He had soft plaque in a coronary artery. This is essentially a blister or pimple. It may not be very impressive, but when it ruptures, it may block an artery or travel downstream to cause a stroke. Now, he also had very high inflammation. His triglyceride levels were high, his HDL cholesterol level was low, and he had a waist size greater than 40 inches, which in men is very significant for inflammation and high cardiovascular risks. Now, a soft plaque in the presence of inflammation is extremely risky. It is not a 5% chance in the next 10 years of having a heart attack. It's a significant chance from day one. And 2 weeks later, he had this and he died. Now, what is unfortunate, I feel, is that he did not have the appropriate testing to tell him you have soft plaque and you need to do something about it. And two, though they knew his triglyceride level, his HDL cholesterol level, and his waist size, did not relate to him the extreme risk this presented because of the inflammation. So he left thinking, I'm okay. He was not okay. And I do not want this to happen to you. Now, the technology is there, I told you. At Expanding Choices, we use HeartSmart IMT Plus technology. And you could go on their website at heartsmartimtplus.com and learn all about it. Okay, we use this technology. We've been using this for 6 to 7 years. And this can tell us if you have plaque, and particularly soft plaque that's vulnerable. Now, in addition to this, we utilize the Boston Heart Lab blood chemistry panel, which tells us if you have inflammation, and if there is inflammation present with soft plaque, we know you are at extremely high risk and need to do something about this. You may have no symptoms, you may have no family history of heart disease, but if you have inflammation and soft plaque, you are at extremely high risk. Now, if we find this, we institute treatment programs to deal with this. You can actually prevent an event. If you lower your inflammation and keep inflammation low through diet and lifestyle measures, even if you have a soft plaque, it may never rupture. It ruptures in the presence of inflammation. Okay. If you do have soft plaque, again, we can institute measures that may help to stabilize this plaque and, in the ideal situation, reverse this plaque. So I am asking you to look at these testing parameters that can clue you in if you have soft plaque or inflammation. It's extremely important because you can prevent an event and not fall prey to the situation of Mr. Russert where he had high inflammation, had soft plaque, but was not told this. He did not have the right testing done to identify if he had soft plaque. So if we can prevent 80 to 90% of heart attacks, let's do it. If we can prevent 50% of strokes, let's do it. It's a simple test, painless, takes about 15-20 minutes. The blood chemistry panel is also a relatively painless procedure, and you can get a wealth of information. And if you do this year after year, you can track your progress, and in the end, you may prevent an event. If you'd like to learn more about this testing and our Prevent an Event program, please give us a call at Expanding Choices. Our phone number is 505-508-1745. We look forward to working with you so you can prevent an event. Thank you for joining me today. I look forward to joining you in future videos.